Hi class, I am Angela and I am presenting my video presentation on my topic, which is the unspoken stigma, PTSD, and the African American male. I chose this topic because it is actually dear to me in the sense that I have a lot of people that I know of that are in my family and a part of my family and extended family who have been either previously in the military or are currently in the military and suffer from PTSD. And not just the men, but I also have female friends and family who suffer from it as well. So that's why I chose this topic. So let's go to the first slide. I wanted to start off with this first slide just to talk about how really um, the uh, uh, the difference between physical pain and mental pain. So Tracy Morgan wrote a little excerpt here and Tracy Morgan is an actor slash comedian, and he says delusional pain hurts just as much as pain from actual trauma. So what if it's in your head? And that actually was very powerful to me. Um, I thought about the fact that what he's really saying here is that physical pain, mental pain is just as painful as physical pain. The only difference is with physical pain, it dissipates in a short period of time. With mental pain, it actually could last quite a long time, and it sometimes can worsen. So it's more debilitating than physical trauma. So I thought that was really powerful to kind of get a better understanding of what PTSD is and what it does to those who suffer with it. The next one is from Mason Cooley. Every day begins with an act of courage and hope getting out of bed. And I thought that was just even good for us in general. Every day starts with hope. And if we don't have hope, we are most miserable. And I think that it takes courage to get up every day and try to have a sense of normalcy when you suffer with a mental illness, even when you don't. I mean, I think, and this might be far fetched, but I really believe that all of us have a little something that we suffer with. And it may not be as extreme as the next, but I feel like we all have something that we suffer with. Okay, so next we'll go to the research problem. The problem is that it's an unspoken disease that goes untreated in the African American community and it gets overlooked. And a lot of that is due to the stereotyping that, they do with, as it relates to African Americans and African American males. And then in the African American culture, stereotyping is very prevalent, and it's not just in the African American communities, but that's what I was studying. And although I did see other areas, other ethnicities that struggle sometimes in this area as well, like the Hispanics, Latin, and Asian and Pacific Islanders. But it was really prevalent in the African American community because if you look at the stats, a lot of times African Americans are they're more privy to being incarcerated. We have it is the stereotype that if African Americans, if they look a certain way, then that means that's they're mean, they're gonna do something to, like and if you've never experienced it, it's easy to say no, that's not the situation. However, none of us can say that because we've all experienced some level of stereotyping in each of our ethnicities. It is very prevalent in the African American community. If they're looking a certain way when they're walking down the street, like literally, if they have a nice car, What's wrong with them going to work, getting paid a good paycheck, and doing the work and doing what's necessary? Everybody is not a criminal. Everybody is not going to hurt somebody or out to get somebody. So it is very prevalent. Um, there is, I'm sorry, forgive me. Okay, so researchers have said and stated that that there's misinformation that causes about the causes of mental illness, and it's a potential factor in perpetrating the stigma and the beliefs. So it's very true because there's so much misinformation out there as it relates to mental illness. What it is, what it's not, what it looks like, and nobody knows really what it looks like. Like, who's to say what it looks like? You can't look at a person and know that they struggle with a mental illness. So just being informed correctly is important. Okay. In the African American culture, also, the African American culture is like this. So families were taught at a young age, growing up, you don't talk about what we talk about in this house. Nothing goes outside of these four walls. We are a family. We stick together. We're strong. That is the idea. We are strong. And whatever it is that we're going through, we can get through it if we band together. You don't have to talk to anybody outside of here. So it's not correct, but it's done. And it's done because of what our parents and their parents were taught. So it's just passed down. It's definitely passed down. And research suggests that incorrect information about mental illness is passed down through generations in the African American families. And it's very true. Next slide. Research question: what is the fear behind African American males seeking treatment for PTSD? There are so many things. Let me see. Okay. So epidemiologist Sherman James stated that when blacks go to the hospital, they don't come out again. Or they say that they're not going to be the guinea pig. And it's because of things like the Tuskegee experiment and other medical mishaps that toyed with the lives of black men. And in the Tuskegee experiment, these African Americans were injected with syphilis. And so, of course, you have to know that, it's our ancestors, and all of those things are passed down. So again, it's something that is passed down through the African American family. And it doesn't mean that because that happened then, it's going to happen now. However, you can't erase what has happened to make people feel the way that they feel, and their feelings are valid. So, that's a lot of what it is. Also, the healthcare system is mainly geared towards women. When you go into the doctor's offices and the clinics, what do you see? You see nothing but advertisements about women and children. Everything is about women and children. Everything as far as things that they need or that they're in need of, or treatments or whatever. You don't see a lot at all about men. And so, of course, that builds up this fear in a sense. So we just want to be mindful of that. Let me go down. I'm sorry. Excuse me. Okay. So lack of trust in the medical profession, culture, fear of being the guinea pigs. We talked about that. Accessibility to resources. We don't have a lot of accessibility to resources, not as much as the Caucasian community or some of the other communities. Latinx is about the same as we are as far as when you look at numbers and percentages. Asians around about the same, just with the a few numbers off. But a lot of it, we don't have the same access. Medical insurance is super expensive. They don't make it where it's friendly for everyone. Everyone is not in the upper class. We have middle class, and then we have the lower class. And unfortunately, those who struggle or are poverty stricken, or even the middle class, it's difficult to afford good health care, unfortunately. There's lack of finances, which, goes back to employment, because of the stereotypes that we have. It's difficult a lot of times to get the positions and the jobs that they actually are able to do and are qualified for. Sometimes they don't even get the opportunity because of the simple fact that they have the color. It's because of the color of their skin, and that's our reality. They're looked at as weak. There's a stigma surrounding it. So researchers have stated, let me see, clinical professor Ruth White. She stated that if an African American person with mental illness acts out in violence, they're much more likely to be criminalized than to be given the opportunity to receive mental health care. That is troubling to me. Then their researchers stated that mental health stigma occurs when people have negative thoughts and beliefs of those with mental health illnesses or treatment. Mental health stigma is related to an assortment of negative outcomes, including discrimination in housing and employment, reduced usage of mental health services, and poor mental health outcomes. Very, very, very true. Then there was a qualitative study suggesting that African Americans, males, were more likely to feel embarrassment related to mental health problems and seeking treatment, stating that mental health stigma was a significant problem in their community. This has all been researched. And then in the African American community, mental health issues are often compounded by the psychological stress of systemic racism. It is an issue that is ongoing. It was way back in the day, and it is still happening right now in the 2000s, which is heartbreaking. Research purpose. We want to bring awareness to the African American community, want to educate them, encourage them, and empower Black men to recognize that they don't have to suffer in silence, and to help them understand the common factors. It's been noted that men, and this is by Thorne and Strata, men are at higher risk of experiencing mental health issues than the rest of the population due to racism and socioeconomic disparities they encounter daily. Murin stated that African American men, like all men, have been socialized to avoid expressing their feeling of weakness and vulnerability. African American men have always been taught to be stoic and not to complain, not to show their woes or their pains or their suffering. And this is a powerful barrier in our society, and we value the man that doesn't show pain, and that is incorrect. I think that we need to let people know that it's okay. Like, it doesn't mean that you're weak. It doesn't mean that you're less than a man. Doesn't mean that you're less than a woman. Doesn't mean that in any of those things. It just means that you're human, and it's humanity, and you have an issue, and it's okay to have that issue as long as you know where you can go to get help for that issue, and to understand that there is help. There's help out there. There's help everywhere. And we need to really embrace that. We really want the African American community to know that they're not alone, that there are so many others. Research shows that there are the Latin, there is some Caucasians, there are Asians, there are Pacific Islanders, the Native Americans. Everybody is experiencing mental health issues. Now, one thing that research shows is that African Americans, whether they're poverty stricken or whatever, are more likely to share that they have these issues, but they're not willing to go and see someone. They are, because a lot of our the African American people in the African American culture, it's highly religious, and so they're more apt to trust in their faith and prayer and their belief in God, or to go through someone in the church. And that was also a part of the study that I found, information that I found out. And I've seen that. I've seen that. We've been taught, especially if you're a believer, it's all you need is God. You just need to pray. Well, there was a time when, out of my ignorance, I used to say the same thing until I started digging and getting into this thing about mental health and understanding that no, prayer coupled along with therapy coming together is something that can help, something that is a home run. So we want to make sure that we can bridge the gap between the the church community and the behavioral health community, that we come together and educate. That's important. Okay, this next photo is very powerful to me. This is about PTSD, post-traumatic stress disorder. There are wounds that never show on the body that are deeper and more hurtful than anything that bleeds. Don't wait until you break. And you see that? You can see that little tiny line in piece of string in there. It's like, this is when you've had enough and you've been hurting. It's so much anguish. It's torment. And it's like, what are you waiting on? Speak up, say something, go get the help that you need. Conclusion. Poverty is detrimental to psychological well-being, with the NIMH data indicating that low-income individuals are 2 to 5 more times likely to suffer from a diagnosable mental disorder than those of the highest group. And then I'm going to go down. And poverty possess a significant obstacle to getting help for these mental health problems. There's lack of affordable health insurance, including mental health and substance abuse coverage, that impedes health and well-being. Low-income groups are the targets of discrimination based on their socioeconomic status, as well as other social indicators such as race, ethnicity, and gender. Psychologists, as researchers, service providers, educators, and policy advocates have a responsibility to better understand the causes of poverty and its impact on health and mental health, to help prevent and reduce the prevalence of poverty, and to effectively treat and address the needs of low-income individuals and families by building on the strengths of communities. Go to my conclusion. My conclusion is, I said basically there are many things that plague the African American communities, from seeking treatment for mental health illness such as incarceration, lack of finances, and suicide. Those are just a few things. These hardships have increased tremendously and caused an increase in mental health issues as well as in this community. According to the Office of Minority Health, adult African Americans living below poverty are 3 times more likely to report serious psychological distress than those living above poverty. Socioeconomic issues make it difficult for those living in these circumstances. And that was from Lewis. Basically, and this last part I can just say, this is what I feel, and this is what I hope to do. It is time for us, again, to join together, bridge the gap. It's time for us to be a part of the change and not a part of the problem, to be a part of the solution. It is time for us, for those of us who have influence, to utilize that influence. If you have influence in a certain group or a ethnicity or an area or a community, use your influence to talk about mental health. Just keep putting it out there. Keep putting it out there. It is time for us to open up our mouths and to lift our voices and to talk about mental health and to educate our peers and our loved ones and those that are struggling. It is time for us to do what we need to do in order for everybody to get the help that they need. We need to be compassionate. We need to not be judgmental. If somebody is struggling with something in a mental illness, that's a time for us to just share. Sometimes it's just having a conversation and just what's wrong with sharing your issue. It doesn't mean that I have to tell all of my business, but I'm saying sharing, being vulnerable, having a heart of compassion, and sharing my struggle or whatever that situation may be, but talking about it so that they start to feel comfortable enough to then share their issue, to see that this is a safe place. It's okay. Um, and Definitely not to be judgmental. And I'm trying to make sure that I hit everything that I said. Oh, yes, this is a good one. Show compassion. Okay, no. Refrain from being judgmental and be aware and sensitive of how you speak and what is being said. Our language has to change. Last, be an advocate. That is super important. Be an advocate. Nobody can tell your story like you can tell your story. Be an advocate for those who can't tell their story. If they've shared with you and they're not strong enough, be an advocate for them. Tell the story. Talk about mental health and get them to the right places. Get them the resources that they need. Get them whatever it is that they need and use your voice. Embrace your voice. Use your voice. Talk about it. Don't just talk about it, but be about it. Do something about it. And then, you don't know whose life you could be saving or changing just by being open and care and showing that you care, showing that you're compassionate, showing that you're not judging, showing that, guess what? I'm not superhuman. I'm human and I bleed just like you bleed. I laugh, I cry, all of those things because people sometimes think, even especially as believers, that we're superhuman and we're not. So I just want to encourage you, do what you need to do, open your mouth, use your voice, and make a difference. Thank you.